A very good morning to you, all my dear friends. In the last video, we had started with the case history part of the presentation, and we had covered the basic definitions of case history, and we had also covered the basic aims and objectives. Now, in today's lecture, we're going to cover about what is the need. Why do we need to take the case history? What is the significance? What are the various components of case history? So I will just go to the presentation, just a second. Hi friends, so now the topic for discussion today is what is the need of taking a case history? Why should we be doing, what is so much significance of taking the case history? Now we will be discussing what is the need of taking the case history in detail. Now, basically taking and recording the complete case history of the patient before the dental procedure by the pediatric dentist or the dentist are extremely important and technically should be considered as a duty only. Okay, it's the duty. We have to do it and it is compulsory. Now, one of the main reasons why case history recording is needed or it's mandatory is that it kind of, when you start your conversation with the parent and the patient, what happens? You kind of build a rapport. Okay, because rapport building is very, very important, and the factor of trust is initiated by you constantly being in, talking terms with the patient. And what you should do is that you should take maximum information from the patient, especially regarding his chief complaint. Because in the future slides, we're going to discuss about chief complaint in detail. Because remember one thing, that a chief complaint is a very, very critical part of the case history, because that's the reason why the patient has come to you. I mean, that is the reason for his visit. So we can't take the chief complaint very lightly. And based on his chief complaint, we have to do our further investigations and try to correlate the intraoral findings, then give a diagnosis, and then suggest even a treatment plan. So the chief complaint is of utmost importance. And what we should try to do is that when we are taking the case history, various related and underlying conditions that might be directly or indirectly related to the patient's chief complaint, be it be a medical condition or any other dental condition. So we get a lot of information about that also. And what happens is that basically we can look into the various preventive measures. Okay. So that is also very, very critical. So in short, if I have to say that if you want successful dental treatment happening, and it can be achieved by recording the case history in detail, and then this is followed by a complete clinical examination and then appropriate investigations. So the case history provides all these things. Okay. So the medical information is taken in detail. Then the dental, of course, is taken in detail. And in the medical history, especially the drug history is very, very important. Which medication has he taken prior to coming? Which medications is he allergic to? Is there any underlying systemic condition? So we need to know all this, because this will have a direct dental implication, because there are certain medical conditions, there are certain medications which might have to be taken, altered, or stopped if the dental procedure has to be, done properly. So now basically what does this mean? That is the awareness of the dentist about the history, feeling, and attitudes of the patients, and their ability to communicate with them is one of the most important tasks in the dentist, for the dentist in the diagnostic process. Because getting information, like you can consider this like kind of a detailed conversation in which you're finding out more and more things about the patient, so that will help eventually in your diagnosis, in your treatment planning, and future preventions also, because that's also very, very critical. Now, the emphasis on taking case history is not only useful for the dentist, to treat the disease, but also emphasize that before any treatment, the dentist must obtain the necessary information with two things in mind: what risks the dentist might face from the patient's side during the course of the treatment, or what risks the patient might also face from the dentist side. So the risk factors also can be, like highlighted, and we can get to know about it. Then, according to Mellon's point of view, during the process of becoming a doctor, unfortunately, something strange occurs. The medical students forget to talk with others. He also noted that it should not be forgotten that patient care starts with communication, attention, and interest in the patient. We should clearly, because the more detailed case history you take, the more you converse with the patient. Many a times, what happens? The patient will share many things which will help in our diagnosis and treatment plan and future follow-up also, and prevention also. And studies have shown, okay, that with careful patient's case history, 90% of the risky situations can be avoided. So taking a thorough and complete case history is an important task and a professional competence of a dentist, and can be important and beneficial to prevent and resolve various issues of the patient and the physician. Now, furthermore, what happens, based on the case history, details that you obtain by the case history, you can plan the preventive care. The preventive care is the most essential part. You don't want the patient coming again and again and again with the problem. You don't want them coming again and again. Yes, follow up and recall is a different thing. But suppose, for an example, a child had 12 to 14 carious lesions and full mouth rehabilitation was done. And he comes after 6 months with broken fillings, dislodged crowns. It is very difficult. I mean, it is not that, they have to keep on coming. But once you have done the proper evaluation and given proper post-operative instructions, post-operative care, and regular recall and follow-up, what happens? The patient will never have the same problem ever again in the same quantum. So suppose, for example, he had 15 carious lesions. So you have treated them nicely, and when he comes for his recall visits, maybe, there might be a broken filling or a broken restoration here and there. That's about it. All of them going haywire is not advocated. And this is the importance, and all this has to be done in the case history itself. And finally, it's a very, very challenging stuff, okay? Because sometimes what happens, there are various barriers, okay? Sometimes the child is very small, so no history can be obtained from the child itself. And sometimes the parents, okay, are unable to give a detailed case history also. So there will be a lot of limitations. So for whatever limitations, a detailed examination, okay, along with a little bit of information from the parents, will definitely be of great use. So now the second biggest question is, when does the case history recording begin? Okay, when does the case history, does it begin when the moment the patient steps in your clinic? Yes, maybe. Okay, or does it become once you open the child's mouth? Is that? No. The case history begins at times from the phone call. Okay. Yes, the patient gives you a call directly, okay, and asks for an appointment. So don't be very mechanical. If the patient gives you a call, okay, sir, my child has a dental problem, when can I bring him to you? And we say, bring him tomorrow at 12:30. No, it should not be so simple. Try to extract a little bit information from the patient. Okay. Ask him, where do you stay, man? What are the preferred timings? Okay. Is the child having pain currently? Is he having a swelling? Is there anything more? How urgently would you like to see me? Would you like to see me today itself? Would you like to see me tomorrow? Maybe next week? So that also is very important. So answering the phone call is very, very critical, because it is the first contact. And sometimes he might contact your clinic. So if the patient contacts the clinic, the assistant also should be trained to take down the name of the patient, the age of the patient, the address of the patient, and if anything urgently is required or not. Because sometimes on the phone itself, okay, because now is the time, what happens? We are in So much advanced in communication that a video call is also possible. Okay, a video call can be done if required. So the phone call is very, very critical and it cannot be taken very lightly. So now, but there are different types of phone calls. It can be an emergency call, or it can be a call for a recall visit, or it can be, they want a complete dental checkup or a dental treatment to be done. So these are the three calls now you might receive in your clinic. Now, emergency call is a very, very critical aspect. Now, in the emergency call, two people can receive the call. Either it's you, the patient knows your number, he gets in touch with you directly, or he will contact your receptionist or assistant. So now we should understand that when a patient calls, timing is very important. Okay, suppose he's called you up in the middle of the night. So should we be very angry and say, why did you call up in the middle of the night? Don't you think I'm sleeping? This, that. No, 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 no. It's an emergency. So you have to be very, very compassionate with the patient. Because in an emergency call, the emergency call can be for various reasons. It can be a traumatic injury. The child has had a fall. Okay. And there is a lot of bleeding. He's torn his lips and maybe a few teeth are fallen out. So that's definitely an emergency. What else can be? Accident, roadside accident maybe, and he's fallen on his face. The first thing they remember is a dentist. So he might give you a call for that. Or it can be because of a swelling. There's a very big swelling and the patient wants to see urgently. Or it can be severe. Okay, so the emergency call management becomes very, very critical. So this call can come directly to you or it can come to your clinic or assistant. So proper protocol has to be set that how will I manage this emergency? Now I'll give you a very simple example. The patient gives you a call maybe at around in the morning hours, 10 or 12 o'clock, and he's in Goa. And he's fallen down in Goa and the tooth is in his hand. It's an avulsion kind of an injury. Now you are situated in Mumbai. How will you manage? You can't tell him put it in a jar of milk and whenever you come back, I will fix it up. No. The instructions have to be very, very clear. You can say, what can you find out around? Okay, can you find maybe coconut water or maybe a little milk? So please put the tooth and visit the dentist, whoever is close by, immediately. Okay, that is also possible. So whenever an emergency call comes, the instructions have to be very clear. Majority of time, if you are available, please attend the emergency. And in today's time, as I mentioned earlier, video call. If you are in a proper Wi-Fi range, tell the patient, please give me a video call so you can instruct accordingly. Okay, so that's very, very important. Okay, so attending the patient's call is very important. On a second call might be for a recall visit. Okay, that, sir, 6 months back, I had done the treatment and you had told me to fix up another appointment after 6 months. So I have come up. So that can be a recall or a periodic. So that also has to be managed accordingly. And on this phone call, remember, if it's especially a new patient, try to take a little bit of details. How old is your child? Where do you stay? How urgently would you like to see me? Is it an emergency? Okay. Is he taking any medication? Does he have any other medical problems? So whatever verbal history you can take, your assistant has to make a note of it, or you make a note of it and have a format ready. So please make a note of it, so that what happens when the patient comes, you are ready. Because being ready is very, very critical in pediatric dentistry, because timing is very, very important. You have to do everything very quickly because the child's attention span is very, very limited. Then finally, it can be the patient can give a call for complete dental treatment, and so those things can be fixed up. So attending the call is very, very critical. And these days you have the facility of sending by WhatsApp, having a video call facility on. Attend to your patients whenever they have a frantic or whenever they give an emergency call to you directly, because no patient will call you for time pass. Whenever they have an emergency, either severe pain, swelling, or a trauma, please attend to it as soon as possible. And if you are not around for any reason, get them in touch with one of your close associates who will take care of the patient in your absence. But an emergency protocol for the clinic has to always be done. We will stop at this particular point, and in the next lecture, we are going to continue further with the case history, the different other aspects of the case history. Thank you so much for your precious time.